The surgery we're going to see today is somebody, giving the best gift that they can to someone else, and it's just an amazing thing to be a part of.
During the week, I scrub, usually in this room doing the laparoscopic donor nephrectomies. I pull all the supplies that are going to be used to establish the sterile field. I open them all up, set up the table, get all the instruments together, and get the room ready for the procedure.
I'm a nurse anesthetist here at MUSC, been in practice for about 30 years. My role is in a number of areas. Number one, we'll see patients preoperatively, evaluate them based on their health level. Some people have problems with their hearts, or some people have diabetic problems. And so what we have to do is gather information ahead of time. So we're sort of breaking down the patient into systems, so like their lungs work well, their heart works well, their endocrine system works well. And then we develop a plan for the anesthesia, which also incorporates the type of surgery they're going to have. So if you're having heart surgery, the anesthetic is going to be a little bit different. And so the preoperative area, getting the patient ready, is one of the areas. The second portion is actually meeting the patient and reassuring them, educating them about the anesthesia and sometimes the surgery if they have questions, but mostly towards the anesthetic portion of the procedure. What to expect at the beginning, promises to take good care of them and make sure that they're asleep during the procedure, and then at the end to wake them up and get them safely over to the recovery room, and then seeing them the next day to evaluate whether or not there were any problems or things that they liked or didn't like, or any issues with medications, side effects, that type of thing.
I consider myself a patient advocate because the surgeons kind of sometimes have the surgery on mind, and the scrub tech has setting up their table on mind, and so I have to make sure the patient's positioned correctly so that they don't get any pressure ulcers or anything like that, and just kind of watch out for the patient.
My role as a student is mainly an observer in most things when it comes to the OR, and then I can give a hand whenever they just need an extra hand, just doing little things. I found what I really like about the OR environment is it's really hands-on. Clearly you're doing stuff, and there's instant gratification in that you see you're doing one thing and you see the result right thereafter.
All of the surgeons have different likes and dislikes and just different idiosyncrasies of what they prefer for different cases. This case, he's very particular because it is a healthy patient, a necessary procedure, so he's got definite steps that he takes and things that he does to ensure the safety of the patient.
We're sort of like lifeguards in the operating room. The surgeon's too preoccupied to pay attention to blood pressure and heart rates and how patients are responding to anesthetics or anything like that. So anesthesiology and nurse anesthesia is a place where we stand and we actually watch the patient, and we interact with the surgeon, and we either treat problems that come up from the surgery, or we add anesthetics so the patient maintains sort of a stable track heart rate, blood pressure, so the patient isn't overly stressed, or what I want to say, maintains a stable physiology during the procedure. So it's very much like being a lifeguard if you look at it in sort of simplistic terms.
For me, healthcare was just an opportunity to do what I really want to do. I've always wanted to really do sports. I love sports. When I realized that the NFL and the NBA isn't in the sight of a guy who's 5'9", 135 pounds in high schools, really not much chance making it to the NFL. So I told myself I wanted to be an orthopedic surgeon so I could do sports medicine. First 2 years are your basic sciences, and third year is when you finally get a chance to get out the classroom, to get into the hospital, to go in the OR, spend time with patients, and really get a chance to do what you've been waiting a very long time to do.
You know, for anybody that's interested in becoming a nurse or a nurse anesthetist, I think one of the key things is you really have to like people. And you got to have some empathy towards an individual that you're taking care of, so you can put yourself in their place. And I've been through surgery before, and so I'm kind of interested in that whole process, because you can either feel like you're well cared for, or maybe that people don't care for you. And so I think the important thing is being able to bond with the patient so they understand that you have their best interests.
What makes a good circulating nurse is watching out for the patient and making sure that they come first in everybody's eyes.
If you like sciences, math, chemistry, the things that you have to actually take, biology, the things that you have to take to become a nurse or a physician or a nurse anesthetist, that's a good place to start too.
I'm here on trauma transplant. We're very tight and good friends, and I do like the surgery itself also. That's why I picked this team. I like transplants and I like trauma.